People who work in hospital, what is the worst thing you have seen a patient go through? Had to take X-rays on a dead 3-year-old who was supposedly beaten to death by her parents. I found partially and completely healed fractures of wrists and ribs, indicating long-term abuse. It'd say she had it the worst even though most of it happened outside the hospital. Word on the street was she had been dead for a day or two before the parents even bothered checking on her. I think they shook the crap out of her and caused some internal bleeding, and just left her in her room for a day or two, then finally checked because she was so quiet. Then they brought her into the air. Good job, guys. Had to testify in court. The dad was just laughing and smiling with his lawyer. She was a really cute little girl. Really messed me up for a while. Then a work colleague had a baby girl and named her the same name as this girl, unbeknownst to her. So I feel like she is getting a second chance with a real mom. I was in my second clinical rotation as a nursing student. We were assigned patients and the patient I was assigned to was a grumpy old guy who was 79. He had a good sense of humor but you had to tread carefully around him. He had chronic pain and was diagnosed with colon cancer. His son would visit in the mornings just in time to talk to the doctors doing their morning rounds. His wife had passed a few years earlier. I was helping him get ready for breakfast when the doctor walked in. This was pretty typical, but he was anxious to see the doctor today as he just had a bunch of tests done and was hoping to hear some results so he could be discharged to go home. I usually just finish up whatever I am doing and leave so that the patient and doctor can talk privately. That morning his son was not able to make it in and my patient asked if I could stay in the room with him to hear everything, in case he missed something. I said sure, no problem, as long as the doctor is okay with it as well. Some doctors don't like dealing with students. The doctor just got right to the point. The cancer had spread and there was nothing more they could do. The palliative team would be coming to meet with him this afternoon to discuss where he could be transferred to during his final days. My patient thought the doctor was joking and started to laugh and then just sat there with a completely blank look. As a student I was not prepared to know how to comfort someone in that situation as it was something I didn't have experience with. I felt awful because 10 minutes before he got this news he was telling me he couldn't wait to see his cat once he got home. For the next week he did not get out of bed, refused to eat and take medication or shower, and then I came in one day and he was transferred out. Hearing the news that their newly transplanted heart is being rejected by their body, early stages are treatable and the protocol for testing is there for a reason. But even knowing all of that, it's scary as crap to be given another chance at life and then have it all be hanging in the balance again so soon. I do hope we reach the point where this problem ceases to exist. Stem cell technology allowing us to grow permanent replacement organs compatible with our own bodies instead of transplants with a limited lifespan and a cocktail anti-rejection drugs. This isn't from me but my mother. She isn't a surgeon. This little girl, probably 6 or 7 years old, had some form of spinal cancer. My mother had met and talked to her a couple of times. On this particular day she was excited because her dad was coming home from a business trip to Bali. This little girl was so happy because he was bringing her back a toy. The next day were the Bali bombings which killed her father. She was distraught and spent the next 4 days just crying with little bits of sleep in between. Her mother spent most of that time with her daughter. About 2 months later the mother passed away in a car accident while driving to the hospital to visit her daughter. So her grandparents got the duty of care for her but she passed away 2 weeks later from the cancer. The poor girl suffered worse than I could think in her last 2 months of life, losing most of what was important to her before dying herself. I hope no one goes through anything like that again. My mother thinks she just gave up after her mother passed. This little girl lost everything just by some form of crap luck. My mother donated flowers on her and her parents' grave every year on the anniversary of her death. Sometimes I really do not understand how my mother deals with being an She is quite possibly the strongest person I know just because of that. Jesus freaking Christ. That is horrible. 19-year-old who was 38 weeks pregnant stabbed 9 times in the chest. Emergency C-section was done in the trauma bay. The doctors were losing their crap. There was blood everywhere. Everyone was losing their crap. Mom died a few days later and I am not sure if the baby made it. Last I heard about it the baby was in NICU having frequent seizures. I was a patient in a hospital for a heart issue when I was 22. They kept me for 3 days in the cardiac ward and I shared a room with an older gentleman who I believe was around 80-85 based off his visitors. I never saw him behind the privacy curtain. I was completely okay and sitting up in bed working on schoolwork most of my visit. When his family came in I could tell the situation was bad. His whole extended family came. Everyone from his wife to his grandchildren. He was also on a ventilator that was keeping his breathing up. I'm not a medical person but as I understand this tube is down in your throat. On the same night after they all visited he tried to pull everything off and it set off an alarm and a nurse rushed in. All I could hear from a very muffled voice as the nurse tried to tell him he needed this equipment to live was what kind of life is this? It made me question my own issues and cry in the dark next to him. Patient got in a bad car accident. She ended up with brain damage. Her 2-year-old child ended up passing away. Every day she would wake up and not remember the accident. All day she would ask to see her child and walk down to the gift shop to buy toys for them. Her husband would have to go back and return the toys later. Some days he wouldn't tell her about the accident because it was just too much going through the grief and the crying over and over. This breaks my heart. I can't even imagine the pain. That husband is a true hero in those moments. Dang. Got sent to the pediatric ICU to watch over a 16-year-old who tried to shoot himself in the head in a failed suicide attempt. He broke the bones that hold his eyes in and lost all function of his eyes, for obvious reasons, and also shattered the part of the skull holding the brain out of his upper sinus. He was very confused and obviously terrified. He had just learned he was going to be blind for the rest of his life and need a new skull fragment put in to keep his brain in place. On top of all of this his divorced parents were fighting. The dad blamed the mom because he used her gun. The mom then refused to let the dad visit by not giving him the special code you need to get on unit. It was the single most fricked up night I've worked and I refused to go to that unit ever again. I was a nursing student in ICU. An older guy had been beaten and violated so badly that the doctor's official diagnosis was abdominal catastrophe. It was the first time I understood how someone could be devastated at the prospect of recovery. The look in his eyes when he found out he would have to live with severe permanent complications stayed with me for years. I remember thinking all the trauma therapy in the world wouldn't be enough to help him. Saw a couple lose their baby very suddenly one day before the due date. Saw a man get all of his affairs together and quit his job with a rare terminal illness, then live. Second bit reminds me of Breaking Bad where Walt reminisces on the day he should have died. While a student, family was hit by an 18-wheeler. Both children and wife were killed instantly. The husband wakes up 2 weeks later, and first thing he asked is about his family, watching them break the news to this poor guy. Doctor here. Saw a previously very well old lad in A&E who had fallen in his small bathroom and become trapped between the toilet and wall with his knees flexed. His thighs were pressed against the edge of the bowl and his feet were squeezed up behind him. Paramedics found him after about 48 hours in that position. He came to hospital with 2 completely black legs, rhabdomyolysis, muscle breakdown, and renal failure. Vascular surgery wouldn't amputate, it wouldn't take him, and he died about 2 hours later. I had rhabdo at 39. I'm lucky to have kidney function. Heck, I'm lucky to be alive. That crap is no joke. A guy got in a car accident and broke his back and was told that he'd never walk again. When they tried doing therapy he started wiggling his toes so some hope came back into the picture. The transport dropped him when transferring him from the bed to the stretcher and broke his back all over again. That was 20 years ago now and he has never moved a toe again. Don't forget to lock the bed or brace the stretcher, kids. Haiku, lady who was roughly 40 paralyzed from the chest down due to car accident years prior. Currently on a ventilator through a trach and had a permanent feeding tube inserted in her stomach. When I saw her, she had a bleed in her stomach that was seeping out through the tube and she kept pulling out her trach in an effort to end it all. They ended up having to sedate her pretty heavily to keep her from repeatedly pulling the tube out. Seeing her pulling the tube loose, and watching her actively begin to suffocate with a totally blank look in her eyes was chilling. I cleaned the rooms of the year in my local hospital as a summer job. This woman in her 40s was dying from cancer and she had a room in the year for a couple days to wait for another room in another service. She looked fine for someone who was dying. I mean, she was bald and looked ill, but she was nice and lovely to be around, cheerful, etc. One time I was cleaning the corridor when I heard cries from her room. I opened the door and there she was on the floor. She fell from her bed after trying to walk to the bathroom. I helped her to the bathroom as she was crying, in pain and in fear because she realized she could not walk anymore and that her end was coming. She broke my heart. It was the first time I realized where I was really working. I had a 94-year-old woman who had been beaten by her niece so horribly that she was intubated and in the ICU. This woman was in pure agony and her family wanted to do everything for her. Come to find out, they were keeping her alive and collecting her social security check. While cleaning her up, she grabs my arm and holds it tight. Huge tears well up in her eyes. She looks at me and mouths over the ET tube, "I want to die, please let me die." That night I sobbed the entire way home. This was one of my last days in the ICU. I was a young nurse and emotionally I could not handle working there, and this was the last straw. I had nightmares about being at work and trying to take care of patients. I would wake up and see my husband laying next to me and it took me a minute to realize he was snoring and not a patient who was on a ventilator. It sounds silly, but it's horrifying if you actually think you're in that situation. I wish as nurses we were able to talk about what we experience on a daily basis, but because of HIPAA we aren't allowed. Years later I am now a nurse and I love it. I see awful things quite often, but I have a better way of coping with those experiences. Frick that. That poor woman. Mother backed out of her driveway and didn't notice her toddler had crawled into the culvert under the road. The culvert collapsed and crushed her daughter. We tried to keep the daughter alive while the mother was hysterical and the father was in shock. That was the worst. I've seen worse graphically but not emotionally. I was doing a clinical rotation in the air. The ambulance called and said they were about 10 minutes out with a 19-year male with a close-range gunshot wound to his upper left chest area. Think, the front of your shoulder, just below the collarbone. He came home early and some guys were robbing his house, so they shot him and took off. His parents had to wait in the lobby for the police to finish up with him before they could see him. The angry look on his father's face and the wailing sound that his mother was making are not things I will soon forget. Kid made a full recovery. BTW. He's got a small scar and story to tell. I am so happy there is a positive ending. I have seen many people die, but the worst one by far was a man with active bleeding, hemorrhaging from his esophagus due to long-term alcoholism. This was many years ago and there are better ways to treat it now, but at the time the treatment for this kind of hemorrhaging was putting an inflatable tube down the throat into the stomach. It was attached to some kind of helmet that you had to put on the patient afterwards, which was tough. You would inflate the tube to stop the bleeding but also aspirate the blood out of the stomach with a huge syringe. Just putting it in was horrible. The patient was so scared. There was blood everywhere. He was vomiting blood, crapping blood. He couldn't hardly talk due to the bleeding. This was in the air. We got IVs in him. Started transfusions pouring into him as fast as they'd go. We worked on him for a long time but he didn't make it. What I remember is how hard he fought, how scared he was and how much blood there was. And this was before rubber gloves were worn for everything. I just threw out my uniform. Everyone's shoes were soaked. I never saw anything like it, before or since. Don't become an alcoholic. Don't get cirrhosis or esophageal varices. It's a bad way to go. Not exactly something I saw the patient go through, but I saw the sweetest old lady who was suffering with chronic kidney problems because, when she was younger, she worked as a maid for some evil twisted people who forbade her from using the toilet at work, i.e. 9-5 not including travel. So she had to force herself to hold a full bladder daily for hours at a time. This is a great way to get stones, which in turn can cause obstruction and damage the kidneys. She was so sweet and lovely, and it just really got to me that people could be so needlessly maleficent. I volunteered in a children's hospital throughout high school. There was a 16-year-old patient there who had spina bifida and had no feeling beneath the waist. He had routine surgery and expected to be in the hospital for about a week. The worst thing I've ever seen was the look on his face when he told me that the doctors had found MRSA on both of his legs, and he wouldn't be leaving the hospital anytime soon. Hospital trips are kinda funny. The first week everybody wants to visit you, but after that guests seem to taper off dramatically. I remember him stating that the hardest thing for him was the lack of social support beyond his family, and to a much lesser extent myself. as this was like the year before Facebook really being a thing that everybody had. Happy ending though, he eventually did recover from MRSA after spending around 6 months in the hospital. Watching a new mother bleed out while her mother held her dead newborn grandchild. Frick me, that still screws with me. All these stories are terrifying, but that one sentence painted a worse picture in my head than any of the others. That poor woman. I worked at the hospital in high school. I delivered food trays to hospital rooms, so it was a very easy job. We were encouraged to have brief conversations with the patients to try and cheer them up a bit. The hardest one to deal with was our high school principal. Our principal dealt with 2,700 students but was beloved by all. Not often you find a person like that. Well, one day she got real sick and had to go to the hospital. I walked into her room and saw her in there. Somehow she remembered my name after I had only met her maybe twice. I saw her every day I worked and saw her degrading for months. All during this time people in school had their rumors that she was getting better. Somebody's mom saw her shopping. People heard she was coming back next week, etc. I couldn't say anything obviously, but it was very hard to deal with watching so many people have hope and me knowing that this truly wasn't looking good. She died about 3 months into being in the hospital. The school was devastated. Worked in an orthopedic clinic and we had a woman come in to have her shoulder replaced. She was pregnant. A man broke into her house with a shotgun, killed her husband, shot her in the shoulder, and then killed himself. I don't know the reason. All I know is that she was now a future single mother with a dominant arm that was basically non-functional. That's devastating. Basically anytime a patient, especially elderly, is hanging on with every possible form of life support, vent, dialysis, repetitive coding, and the family refuses to make them a DNR. I know it is a hard decision to make. I know you don't want to see them die. You also don't want to be in the room when they code. You don't want to be in the room the third time they code, wondering if we will be able to bring your loved one back again, just to see his chest rise and fall mechanically, to see him being turned every hour and leaving the room so that your modest dad can have some privacy while we clean him up because he can't control his bowels. Please think about what the person would have wanted. 2 of them, both senior citizens. They both haunt me, years later, because I don't know what happened to either of them. The first came in as a homeless woman in the winter. She was fine, medically, but homeless because her husband died, and her absolute demons of children took the family home out from under her, leaving her on the street. Somehow ended up in my city. They put her on a psych hold, just so she had somewhere to sleep while they figured out where she could go. She was in her 80s. Her entire life was in a grocery bag. The other was a transfer to Iro after being medically cleared elsewhere, because ours has a psych and the other main hospital in the area does not. Also in her 80s, I believe. She was the sole caretaker of her very ill husband, and reached a point where she felt it was impossible. Just everything. Life. She was so tired, so she drugged her husband and herself, so that they could die together. He died. She lived, and was sent for a psych eval. I assume there was a criminal legal discussion as well. I wish I had remembered her name, just so I could try to find the outcome. Work in a mental health hospital. Freaking dementia. Horrible, horrible disease that affects the people you love more than you because, on the good days, you don't know you have it. I've seen people screaming out for their husband who died years ago. What do you tell them? They're dead? Why put them through that again? Do you lie and say they're on their way out shopping or something else, knowing that will placate them for 10-15 minutes until they ask again? Frick dementia. I don't think there's an illness worse. Advanced and inconsolable dementia. Dying of respiratory failure. Young mothers dying of cancer. CPR on the elderly with rib fractures and resulting trauma. Suffering from mental illness following terrible sexual abuse, assault. A physical assault exam after a physical assault. It's invasive and exhausting. People having to choose between keeping their home and having adequate medical care. Seeing the neglect in long-term care. Patients left untouched, unturned, unchanged, unfed for an entire shift. Reporting it and seeing no response. It's freaking brutal out there. Wasn't employed by the hospital but worked as an interfacility transport EMT at the time. Had one patient that had terminal bone cancer and was morbidly obese. I was transporting her from the hospital to a radiation appointment. I developed a rapport with her and she opened up and told me how she is just buying maybe 6 months by treating the cancer, otherwise she would have died already. Well, as some of you may know, bone cancer is one of the most painful and terrible ways to die, so for her to extend that misery for just a little longer so she could experience life and see her family a little longer was very inspirational. We get to the facility to do the radiation treatment and are told it should only take about 45 minutes. Then we get to the room where the magic happens and the table she's supposedly on is the same size a small adult would use. They have no modified version for morbidly obese adults. The only way to keep her on are extra straps they use to tie her down to the table. They constantly have to stop the procedure to adjust her for comfort. 2 hours in her fentanyl she was given at the hospital has completely worn off and the facility isn't authorized to administer meds like that. Appointment ended up taking about 4 hours longer than it should have and she was just miserable but still so sweet and apologetic the whole time. I felt awful for her and after it was done there was a huge sense of relief in her voice. I told her how inspirational she was to me to see how resilient she was being. Okay, so technically I worked at a nursing home and I myself wasn't a nurse, but one of the kitchen workers who fed the residents. How it works is I brought up carts of hot food, served the meals on plates according to residents' cards which specified their diets, what they could and couldn't eat. Resident has no teeth, no hard foods, resident can't eat salt, etc. And then the nurses would bring them to designated resident. Sometimes they could eat on their own, sometimes they needed a nurse to feed them. Typically these meals come with a dessert. Depending on their needs and diet, it could be a piece of fruit, or something like a cake or pudding. So during one of my shifts I had just served dinner to the 3rd floor and was packing up to go back to the kitchen. As I was packing up, there was an old lady who I knew was someone who needed to be fed because she had lost a lot of coordination with her arms and was wheelchair bound. Her nurse, who was supposed to be feeding her, was too busy yammering away at another nurse. So this resident who was obviously hungry tried to feed herself the blueberry pie and naturally kinda makes a mess on herself. Poor lady has blueberry all over her face and shirt and the nurse, who should have been feeding her, gets upset and decides the resident doesn't get to eat dinner since she can't behave and wheels her into a corner like she was in timeout, all while she's covered in food. The resident is obviously so embarrassed and just wants help being cleaned, but the nurse walks away before she could even finish her sentence. It isn't unusual for residents to not eat food because it was pretty gross or maybe they weren't feeling it. It happens. So I went downstairs back to the kitchen and cleaned and did my tasks. I usually come back up the floors usually 2-3 hours to collect dishes and drop off overnight snacks. I come back up to the 3rd floor and to my freaking horror that resident is still in that same corner covered in the blueberry sauce. Walked over to the nurse's station and told them about a resident needing help and thankfully another nurse came in and took her back to her room and cleaned her up because her crappy designated nurse was nowhere to found. I cried that entire night after my shift. This poor woman is in a facility because she needs constant help and care and she was treated like a freaking nuisance by this butthole nurse. Frick that hospital and frick that nurse. That place was literal heck on earth. Thank you for saying something. Please report this stuff if possible. In clinical on a burn trauma unit, guy had 3rd degree burns on 80% of his body. He had very little skin left. I could actually see part of his tibia. Fingertips were necrotic. He was heavily medicated but still, I can't even fathom the pain. IDK if he made it BC. He was quite septic last time I was there. I now work in the NICU. Most of the babies end up doing pretty well and going home eventually, but some aren't so lucky. I could go on about the medical stuff, but really the worst is when their parents don't give a crap about them. But some parents live far away and have other kids to take care of, so it's understandable if they aren't there every day. But then there are others who never call, never visit, and no one can track them down. So the kid ends up being discharged to foster care. It just burns deep in my soul sometimes. One day I might hand a perfectly nice couple their baby to hold one last time while we withdraw life support, and the next day I'll be trying to soothe the baby withdrawing from the drugs his me and mom took. Despite the challenges, I still love my job, though. My son is in NICU and it kills me he isn't home. I wonder sometimes if he dreams of my voice and my heartbeat. I'm counting the days till he comes home and drive almost an hour round trip to see him daily. I can't imagine forgetting him and leaving him there. Not one particular patient, but a common occurrence. I work in the post-op unit, and often people have an NG tube. The purpose of these is the removal of fluids from their stomach due to having a bowel obstruction. Often patients become confused due to meds, age or whatever. Often they pull it out and somehow end up vomiting diarrhea. That must be one of the most awful things to experience. I'm done with Reddit for the day. When I was in high school I took a CNA course. We did our clinicals at a state-run nursing home. There was one patient who was 89 years old, had stage 4 pancreatic cancer and dementia. She was married at one point, but her husband had died. They had 8 children. All of them had died. All of her siblings, friends, and close relations were dead. She first entered the home about 4 years before she died once she realized she really couldn't care for herself anymore because of age, general health problems that accompany living for 85 years, and later developed the other ailments. By the time I got there, most days she didn't know where she was, but would have days where she was lucid. She would remember her cancer and that she was alone. Those days she would cry out. As the lucid days got further and further apart as her physical health declined, she got to where she would only eat if I was the one feeding her. I went in on weekends and after school to try and get her to eat and drink something. Watching that poor woman have to face the reality of her cancer over and over again, then realize she was alone and the world was horrible. The day she died I walked by her room as they were cleaning out her things, and saw a picture of her sister. We didn't look identical to one another, but we favored each other. I think she thought I was her sister. People imagine horrible ways to die, but dementia is by far the worst way to go. It is wonderful that you were there for her. Most people don't know their impact on others. That username made me chuckle after a heartfelt story. I'm a children's nurse. I worked on a ward that specializes in brain and spinal tumors in children, amongst other specialities. The worst thing I can think of was a little boy. I think he was 3 or 4 years old. He'd been in a different hospital for 2 weeks with a weakness to his legs that was seeping up his body, eventually causing incontinence. The other hospital hadn't scanned him, which was the first thing we did, and we found his brain and spine were covered in tumors. There was literally nothing we could do. He had weeks if not days left. On my shift he was incredibly poorly and I was trying to push for him to get moved to the ICU. He was barely conscious and there were a few times whilst I was waiting for the medical team I actually thought he'd died in front of me. Being with his poor parents as they went through this, watching their typical, previously healthy child fade away with no information was the worst. The mum asking, "Will he live? Please save my baby." It was truly awful. Thank you for what you do. My cousin passed away at 8 from rhabdomyosarcoma. She had a tumor the size of a peach in her brain. Her nurses were absolute angels and made every admission she had as bearable as possible. Psychiatric hospital, definitely dementia, as is covered throughout this thread, but also patients in deep psychosis, non-stop energy, paranoia, delusions, violence, aggression, the whole works. Strangely enough, these patients, once sane, are usually the nicest people on the floor. The look of horror and regret when they learn what happened to them and what they did over the previous days kills me every time. Emergency room. An old lady came in, I don't know for what, but she came in from a nursing home. There is no way to describe accurately how horrific this woman's condition was. The patient didn't go through this in the hospital, so I DK if it really answers your question, but here goes. Her hair was so matted and dirty that it seemed like the bugs who lived in it couldn't even get to the center of the dreadlock. They ended up cutting most of it off. Her skin was just straight up open, infected, oozing sores. Picture like maybe if you took someone's skin off and laid it flat, then took a hole punch to the entire thing and put it back on. It was hundreds of small, round, infected, smelly, gooey, painful sores on her entire back, butt and legs. Now, her mouth. The decaying and missing teeth were nothing. What was something? Something that we couldn't figure out was the mold. Just straight up mossy mold. Originally we thought she had a napkin in her mouth or was eating toilet paper. Nope, just mold. I had to leave the room because I kept throwing up. This is on top of the regular blood, poop, and pee that they always come in with and smelling like. This lady smelled worse than a dead body. Thank the Lord Jesus and all of his men for nurses, because those people handled the situation like champs. They cut her hair, patched her up and cleaned her mouth. She looked and smelled and spoke like a new person. My brother-in-law's grandma died from neglect in an expensive nursing home. They were putting shaving cream in her pants to keep the smell at bay instead of bathing and changing her. Her only health problem previous, the reason they put her in a home, was dementia. It's a sick world we live in. I had a patient who was an escaped flesh slave. It was a younger individual in their 30s who was dragged into their situation through a drug addiction and was actually supposed to be killed because they were sick, but ended up finding a way out somehow and landed themselves in a local psych ward. Because of their physical health they were sent to the hospital where they died not long after. I forget why. And as I was helping to clean up the patient for family viewing, I saw their rectum was stretched to a point I've never actually seen before or after. They had been waiting until their condition improved to schedule surgery. It was awful, especially with this person being so young. They were swollen all over and bruised before they even died. When the family showed up they just talked over their body like it was a Sunday dinner. No tears or anything. The whole thing was a mess. Jesus Christ. There've been a lot of rough stories in this thread, but ones about awful, cruel people and totally uncaring families make me especially sad. I think I'm done for the night. There was a young girl who came in with maggots in her infected Achilles tendon. Wasn't fun for either of us. 2-year-old boy born to mentally challenged parents who brought him to the hospital at the 11th hour and kept taking him off of his oxygen and have him lie flat even after I patiently explained why he couldn't play. His lungs filled with fluid and oozed out of his nose and mouth as I desperately tried to suction it and give him CPR. Still haunts me. Not a patient, his mom. She brought him in with a high fever, saying he wouldn't wake up. Kid was brain dead. Meningitis. How do you tell parents their only son would never wake up? Operating table. Guy let his abdominal stitches fester and ulcerate. I could see his intestines inflamed and glued together. He somehow survived. Young girl comes in unconscious. We diagnose her with malaria. Do a blood test. Find out she also has type 1 diabetes. No one knew. Treating her was tricky, but I was adamant to make her better. She was literally burning from a fever and was in a deep coma. 3rd day, she wakes, asks for water, dies that night. God help me, I have never cried more than I did when I heard Fernie's gangrene. That's all I'm saying. Guy had a twisted spine and an enlarged heart. He could barely breathe. Pregnant woman specifically was told she could never safely carry a baby to term due to a heart condition. Got pregnant. Heart was overloaded. She struggled with every breath. Schizophrenic woman gave birth. She was off her meds to allow for breastfeeding and was instead on a course of family support and reassurance. She knew she was sick but wanted to take care of her baby. At the same time, she knew she couldn't. It was heartbreaking. She wouldn't nurse her infant. She kept telling me with tears in her eyes that her baby hated her for not being able to take care of her. I'd been a nurse a few years and thought I was pretty awesome. A patient in the ICU was unstable with a heart problem, but with meds, was pretty stable when my shift started. She was a DNR with heart failure. The family had been there for days. Husband, adult sons, daughter-in-law. They were the nicest folks. They were contemplating going home for a few hours to shower, eat, and rest. I told them her heart rhythm looked good. Go home and get some rest. I took their cell phone numbers and told them if anything changed I would call right away. Well, they traveled at last an hour through a dead zone because as soon as they walked out the door I was struggling to keep her alive. Her heart was all over the place. Pressure kept dropping and dropping. I got them on the phone an hour later and told them to come back. I spent 2 hours desperately trying to keep her alive, and they ran back in the door 5 minutes after she was gone. I couldn't stop crying. I felt so bad. There was no professional boundary there at all. We all knew a young stupid nurse took their last moments with their mother, and mom died alone, with a few scattered staff doing what they could, but without her family by her side. That family comforted me more than I comforted them. I was beside myself. They told me I did my best, and it was okay. The grace and kindness they showed me was incredible, and affects the way I treat every family now. Honestly, sometimes I think people wait until family leaves to pass. My grandpa had a room full of people surrounding him most of his last days. Most of his kids, my grandparents had 9 very supportive children, had left to get coffee or a shower or a nap, leaving my mom with grandpa, and that's when he died. I don't work in a hospital, but while I was in a hospital post-op from a surgery on my stomach, I was told to walk around and try to get my strength back. While walking I found out that I was the only kid in the whole wing that wasn't in a huge bus crash that left almost 24 elementary school students butchered, like missing limbs, intestines sticking out, faces and chests crushed, on ventilators and in comas. I found out when my mom asked what happened and the nurse explained there was a horrible bus crash. In residency I took care of a young boy, 8 years old, with E. coli 0157H7. No one knows where he got it and it wasn't part of a bigger outbreak. I'll never forget the screams of pain from the severe abdominal pain and bloody diarrhea, but then I'd go in the room to check on him and when I asked him how he was, he'd just say in a weak little voice I'm okay even when doubled over. Such a tough kid. There's no treatment besides supportive treatments, fluids, pain relief, because antibiotics make renal failure more likely. Unfortunately he did go into renal failure anyways and he died before dialysis could be started. In medical school I took care of a middle-aged woman with advanced uterine cancer. She was extremely obese, 400 lbs, so it was too difficult to do her hysterectomy without first doing a paniculectomy, basically removing her pannus, which is excess abdominal fat. This involved an incision in a circle around her entire abdomen which was extremely painful as it healed since her whole abdomen was involved, so she was essentially bedridden post-op. Because she didn't move, she developed terrible pressure ulcers in her back, a couple of which ulcerated all the way to her bone. She had a ton of fat on her back too, so these ulcers were deep. I could get my whole arm up to the elbow inside of them when changing her dressings. She'd scream and sob anytime we moved her. I don't remember anyone ever coming to visit her and I'm pretty sure she eventually died alone. I went to see a patient during clinical rounds a few years back when I was a med student. I think it was for dermatology. Guy was just a year older than I was, remarkably fit, fairly good looking, and from what little I got to see of him was also pretty mild mannered. Well, so his story was that he loves to play basketball, and he did just so on that fateful day. A quick shower and a wipe down, and he finds blood on his towel. Blood came from his scalp, from some weird scab-like growth. No prior symptoms. Freaks out, goes to a neighborhood dermatologist, and is told to go to a bigger hospital, which is where I ended up meeting him. So apparently he's taken some tests. The prof and I go over to the station to check out the EMR. He grills me a bit on what exams I would have ordered, knowing what I did. One of the answers was a PET CT, and so we checked that out first. Now, for those of you that don't know, a PET CT checks the uptake of radioactive glucose that has been injected for the test. The more active metabolism an organ has, the more radioactivity it shows, meaning it shows up black. Cancer has a lot higher metabolism than normal tissue, so it's a pretty neat way to check the entire body for metastasis. When we loaded this guy's PET CT, we were both struck momentarily speechless. His whole spine and both hips were fully covered in black. Bones should not be black. The cancer, which the prof later told me was a melanoma, a particularly aggressive type of skin cancer, had spread across his whole body. The prof gave him about 3 months to live, at best. The guy was just 1 year older than I was, and a heck of a lot fitter. It was really eye-opening to see that my young age didn't mean I was immortal or invincible. Since then, I've adopted the motto of Memento Mori. I still think about him every once in a while. Well, I'm gonna try and lighten the mood in here and be a bit self-indulgent at the same time. The nurse that worked in the hospital said that this is one of the funniest things she's seen. I had brain surgery and a huge wound, about 10 inches, across my skull. It wasn't stitched, it was stapled. I hadn't had a dump for about 3 days after the surgery, and the nurses gave me some tablets to soften my stool up and coaxed me out of bed to try and bust the crap out. I sat there and strained and slowly but surely the turf inched its way out, but the problem was it was like concrete, and after straining for so long I fainted and fell forwards onto the bathroom floor. Anyway, the nurses came in and found me face down and a big turd protruding from my fully intact. So apparently anesthetic can back you up a bit. The nurse put a glove on and literally pulled the iron bog out of my ass before they cleaned me up. She said it was one of the most satisfying things she has done, and even better that picking Saint get boyfriends blackheads. Legend. This comment was almost the very last one out of all these horribly sad stories, and I'm very thankful for that. Thank you for making me smile after all that sadness. Lol. Stories from last night. Aiku, bed 26, comes in for elective colostomy reversal. Post-op has significant bleeding and goes back to ward to take care of bleeding. Repeat bleeds X3 with repeat or trips X3. I just came in to help turn her and see this woman with eyes that look dead inside. Trachea on a ventilator. Massive abdominal wound with wound vac that will obviously never be closed. Massive blisters all over her body from being so edematous. She's wrapped in chucks from head to toe because she's draining so much serous fluid through her skin. The worst part was she only elected for the procedure because her family was mad at her for smelling so much due to the colostomy bag. Bed 16. I just went in to check the alarms. Patient on CVVH, a type of slow dialysis for hemodynamically unstable patients. Toes are purple. I say to the primary nurse her toes are purple. She replies, just wait till you see her arm. I look at her arm. Her arm is black from the fingertips to the elbow. Black like my PlayStation is black. I say to the primary nurse, she looks dead. Is she with it? Nurse replies, she blinks. Family wants everything done. Bed 19. Possibly cursed room. Steamy. Heart attack. Coming from cath lab. The report. Patient has coded 3 times during procedure before patient is stabilized and they are running levo-fed wide open. Cath lab calls, hey, we're coming and doing compressions en route. Gown up. Gurney comes flying around corner with someone doing compressions on top of frail old man. Blood is everywhere. More staff than I've ever seen at a code ever show up. Easily 10 doctors, residents. Too many people for me. I offer to get the family. Family hopeful upon seeing my stupidly smiling face because I stupidly smile when meeting someone. Tell them he's not doing well. We're doing everything we can, but he's not going to live much longer. You need to see him now. Could literally see the smiles and color drain from their face as I spoke the words and tears forming in their eyes. Even my emotionally dead IQ nurse self got choked up breaking the news to an audience of 20 plus family members. 20 plus family members rushing in while 10 plus staff trying to do CPR. People trying to collapse on floors. People crying, praying to God for a miracle, telling us not to stop. 10 plus rounds of EP given. 2 crash carts of drugs emptied. Floors covered in blood. No miracle. Bed 19 1 hour after previous patient wheeled out by funeral home. Rapid response from med-surg floor. Patient with hemorrhagic stroke now having mental status change. Shows up snoring heavily, not waking up. Patient vomits and aspirates. Concern for airway. Patient is a DNR. Also beginning to have obvious decerebrate posturing. Patient no longer able to speak for self. Family rescinds DNR. We intubate. Anytime we have to watch or put a patient through unnecessary suffering is probably the worst thing they go through. Family should not be able to rescind a DNR that the PT has requested when they are able. God dang. The head and neck ward has a carotid blowout kit for people with neck tumors that are invading the carotid artery and can't be removed. It has towels in it, nothing else. I'm glad to say I've never seen it used, but I once saw an old woman with a nosebleed that no one could get to stop. Just seemed unbelievable that you could die from a nosebleed, but she did. Obligatory not me post. Our friend's stepdad was training to be a nurse, so he got all the gross stuff that came in because, newbie, a homeless man came in complaining of stomach pains. When he told the guy to undress, he didn't want to take off his jeans. When asked about it, he said, I can't take them off, my leg will fall off. Sure enough, his leg was rotting and had maggots crawling in and out of it. How do you reach the point of having a rotten leg but you go to the ER for stomach pains? You have been visited by the romantic doggo. Comment love is magic so you never fall in the friend zone. Like and subscribe, you magnificent person.